Fill your thirst beside the river. Wash the journey from your hands. Feel the comfort flow inside you. Come this far, you understand. Fear's not allowed, where dreams can be lost or found.
Hello. Welcome to Healing Outside the Box. This is our 64th show. I'm Rosemary Lachance, a Reiki energy healer and a spiritual advisor.
And I'm Traci Crampton. I'm an energy practitioner.
And we're dedicated to providing you with food for thought information and answers to alternative healing, spiritual development, animal welfare, and the environmental concerns in the form of guest speakers who are experts in their field. We hope we can help you find the answers you are looking for. We encourage you to embrace the show with an open mind and continue to ask questions that will lead you to better health and greater understanding in your own life. You will find our email information after the show if you would like to send in your questions to have them addressed on future shows. We hope you enjoy the show.
And tonight we have with us an animal acupuncturist, Dr. Gregory Azzolin. He's a certified veterinary acupuncturist. And Dr. Azzolin was born and raised in Queens, New York. His education includes a BS from Ohio State in zoology, an MS from Ohio State in veterinary pharmacology and physiology, a DVM, Doctor of Veterinary Medicine, from Ohio State, earned in 1985. He has operated the Northford Veterinary Clinic since 1986. His internship was completed in small animal medicine and surgery at the New Haven Central Hospital in 1986. He became a member and part owner of New Haven Central Hospital in 1988 and earned his certification in veterinary acupuncture in 1996. We'd like to welcome you to our show,
Well,
Dr.
thank
Azzolin.
you very much for
Welcome, Dr.
offering
Azzolin.
me this opportunity. It's absolutely wonderful.
Well, we've had acupuncturists on for people, and we've also had veterinary medicine, Dr. Tobin. We had a gentleman, Dr. Tobin, on our show.
Homeopathic veterinarian.
Homeopathic. But we often get questions, out in our practice as well as from viewers about veterinary acupuncture. And so we're happy to have you here to answer some of our viewers' questions.
Well, wonderful. Wonderful.
The first question we ask our guests is, what made you get into this field?
What made me get into the field? Well, I was practicing for around 10 years. And as the practice grew and my patients got older and older, what I was feeling was that I had less tricks in my bag. I'd kept up with medicine. I'd studied quite a bit. And as the patients got older, I just didn't feel as I was able to help them as much. And so I went and thought back, what can I do? And when I was a senior in vet school, a resident who was in anesthesiology had introduced us to acupuncture. So I thought that might be a modality that I could incorporate into my practice and to help pets. So I'd been in for 10 years, and then I went back to study.
Broadening your bag of tricks, right?
Exactly.
And have you always had a passion for animals? Is that something that you were born with?
The passion for animals started as I was in 8th grade.
Really? Tell us.
Such a long time. And it was because I was raised showing dogs. And in the city, though, we didn't touch many horses, hardly any cows. So it was pretty much dogs and cats. And I grew up with those and wanted to pursue it. And it was a challenge because someone had mentioned that I shouldn't do it, that I couldn't do it. And so I wanted to beat and get through that challenge, and I did.
Family or friends or teachers?
Oh, guidance counselor.
Oh, really?
Really?
Yes, who I won't name.
So it was the I'll prove it to you.
So, yeah.
Lit your fire.
That's good you didn't let it stop you. That's very good, yeah.
Absolutely not, right.
That's great.
And here you are, you have a thriving practice and seeing...
I'm very happy doing what I'm doing.
Fabulous.
26 years later.
Wow, that's great. And do the people, like, they probably come to you for regular allopathic medicine, right? And then you tell them about that, or do they come to you, some of them come just for that?
Well, some people will come to me as referrals for acupuncture. Some of the acupuncture that I perform in the practice are on patients that I've established over years. But the practice is a mixed practice in that I do Western medicine and incorporate the acupuncture with that. So
It's complementary.
So we do both, and it is complementary.
And you do some natural medicine too, naturopathic, so to speak, in certain, a little bit, you were mentioning to us.
The what we might coin natural medicine, if we're looking at herbs, so Western herbs,
Right.
Chinese herbs.
Good.
So a holistic approach,
Holistic approach,
looking
yeah.
at the pet in a different way than I might have been trained when I was in vet school.
That's wonderful, because they
So
can have both
we do
with
nutrition too,
you. Nutrition, yeah.
right?
That's wonderful. That's really wonderful.
So what is the history behind veterinary acupuncture?
Well, we might start with the history of acupuncture. Dates back about 10,000 years when they had stones. These were bian-shi, or these bian-shi stones. They were about 4 centimeters by about 0.4 millimeters, and they were likely the first acupuncture needles. So it's 10,000 years.
Wow.
The first writings about acupuncture date back likely 2,000 years. Maybe 3. Also, as far as veterinary acupuncture is concerned, there were horse priests, and those horse priests were the ones that basically were the equine practitioners, or the horse doctors. Legend has it that horses that were struck by an arrow in certain areas of their bodies got over lamenesses that they had.
Wow.
So the practitioners would then see that and then mimic it in their acupuncture. However, in India, it dates back 3,000 years, where they actually had performed acupuncture on elephants. So it goes back quite far.
Yeah.
Bringing it to Europe in the 1600s, what had happened is that there were a lot of Jesuit priests that were in China, and those Jesuit priests from the 1600s to the 1900s brought it back to Europe. And in the 1700s, when we had our first French veterinary colleges, they incorporated it into the curriculum. So, but most of the acupuncture that was performed in China was on livestock and on humans, obviously.
See, I never knew that they did that. Yeah, that's wonderful.
So, when we think about dogs and cats, that's relatively new,
Right.
because they weren't held in such high esteem in China. In fact, they're not so much
Working
now.
No, they're
animals, yeah.
Right.
You needed working animals.
So it's something that was, the history of it fascinates me. Now, in the United States, it was President Nixon in 1972 that opened up the doors to China. And so that's what brought acupuncture really to the United States. So that's where we had that. And it's pretty much flourished since then.
At that particular time, not just animals, but all people too, or just that
Animals and people. There was a fellow
72,
who I don't remember his name, but he was a New York Times writer who was following President Nixon at the time, and he had an appendectomy, and they had used acupuncture on him post-operatively to control pain. So it was that fellow that really
Got some
wrote so
press,
much.
yeah.
He was so impressed by it that he wrote about it, and really sparked a whole lot of interest.
I know, and what seems like new to us, these modalities they're so ancient.
Right.
And,
and tried and true.
Yes.
Without
lots
some of
research
the
behind.
science that we have now, this was just thousands of years, millions of patients.
Right.
And so you observe and you see what's going on and what's healing and what's not.
Do you think there's a difference between human acupuncture and animal acupuncture?
The points that we use on animals are pretty much extrapolated from those on people. When we're trained as veterinarians, we're trained to look at our own bodies.
I know, because I
We're
think like
finding the
every
points.
creature is so different in their muscular system, and how do you,
Yeah, right,
you
it's
know,
not like people,
know
we're all the
where to
same.
go on a cat and a dog and a horse and
Yeah.
Well, it's not guesswork.
No. Oh, I'm
Lots
sure.
of study.
Fortunately, it's not
sure
guesswork.
it's not.
It's lots of practice,
Yes.
and that's why most medicine you never get it right. That's why you have to practice.
right.
So,
At least
and that's what
if
we're doing
a, you
is
know, if a
practicing.
human walks through the door, they're, you know, they have the same setup typically, but you know,
Pretty
you
much,
have all
but
different creatures coming in.
it's far different
It's
when
different
you're
every time.
working on a horse opposed to a parakeet. Yes,
Yes.
So you have
and that's
to do
the
a lot
wonderful
of
thing.
a lot of studying then, really, all the different animals.
To be a veterinarian in general, one needs to do an awful lot of studying.
Okay.
But beyond that,
Yeah.
yes, you do, because you're responsible for just about every living thing other than a human
Right.
being.
And I'm sure you have to be somewhat intuitive because you have animals that aren't saying, "Oh, this is where it hurts," or you know, they can't really tell you what's wrong with them. So
That is so true. Being intuitive is just so important because, and being a good observer,
Yes.
that's the big thing, and listening
listening.
to both the human that brings the pet in and to what the pet has to say.
Mm-hmm.
So you're right.
How do you think most animals do most animals accept this treatment on them?
Most of the animals that we have come into our office are pretty special to begin with. These are highly loved and handled pets.
Mhm.
And I would say, for the most part, all of them accept some form of acupuncture, and there's many different forms of acupuncture. But I would say that most do. In fact, cats, who you'd think wouldn't want to be handled at
Right.
all,
Mhm.
really, are some of our best patients, because many times we'll have them on our exam table, place the needles in, the pet owner will sit on a chair, read, while the cat is just sitting there while the needles are processing.
Right. Because they're
And
more
then they get
likely
mo-
to just lounge, and the dogs are all
And the dogs are a little bit
a
happier
little
about
more
moving
happier.
around.
I mean,
They're a little
make
bit more
themselves
excited about
known.
what's happening. The cats don't like it when you're removing the needles. They seem to enjoy having them.
Really?
wow.
Yeah, because it's relaxing.
Yeah.
The dogs normally have one or two visits where they might be a bit more anxious, but once they get through that anxiety and they learn what's going on, we have some where the client will say, well, so-and-so is pulling me to come in the door.
Yeah.
Because they know. and
they
have
instinctively
that
know
feeling.
you're helping, and yeah.
That's what you usually don't see. They're usually pulling them to go out the door.
Exactly. Now
That's
we have Charlie here today, who's likely going to be a little bit anxious, who we're going
Yeah.
to do a demonstration on.
You have to
But
tell
here-
our audience
Yes.
we're going to bring in a dog in a while, Charlie, and Dr. Azzolin's going to do some acupuncture on him so that you can see firsthand how it happens
Yes.
in just a little while. Unless you want to do it now, and then we can continue with the conversation. What do you
That might
think?
be a good idea.
Okay.
Why don't we do that?
Yeah.
All right,
we'll
so
bring
we'll bring in
Charlie
Charlie
on in
now.
whenever she's ready to bring her.
Yeah,
bring
let's
him
take
in.
a few minutes for his owner to bring him in here, and we'll set
How do you
him up.
keep the animal calm? You know, when you're preparing.
Well, a lot of keeping my patients calm has to do with the pet owner and also the pet. A lot of times we'll feed them, we'll give them something
Little
to
treats or
relax
something.
them.
Yeah.
And sometimes we'll
Charlie.
use some remedies too that will do it. Rescue remedy is a wonderful thing, which is a
Oh,
Bach flower.
Right.
Yeah.
The Bach flower
So-
essence.
This is Charlie, everybody.
This is Charlie,
Hi,
and Charlie is
Charlie.
an 8-year-old
Beautiful.
French bulldog. And he's a wonderful little guy. And he's pretty happy here today now.
Yeah, he's pretty
Yeah.
calm.
Fan.
Yeah, he certainly is.
Okay, so I'm placing a needle in Charlie's head, and we can see that Charlie hasn't really fussed much about that.
No.
There's no anesthesia. There's no tranquilization. There's nothing. Charlie has this very flexible, very sharp needle right in his little noggin.
Just
One
like people.
He's done
advantage
very well.
that the animals
done
have
very
over the
well.
people is they don't have
Hi,
these
he's a good boy.
expectations like, oh,
He's a good boy.
they're putting needles in me.
Right.
And I was just going to demonstrate maybe a couple others so that everyone can get an idea about how this really isn't so
We
bad.
could get the camera to do a little more of a close-up there. That'd be great.
Can you get a little closer with the camera?
So people can see.
Can the camera get a little closer?
Okay. Good boy, Charlie.
Yeah,
Just
they're
focus
very,
on
very
Charlie.
fine needles, so they're even hard. They're
They are
hard
extremely fine and very, very sharp.
There, you can see that pretty good, yeah.
Good, Charlie. Now, Charlie
All
has
right, now-
several different ailments, but the primary thing that he was being treated for was arthritis. He has
Okay.
arthritis in his hips, and he has arthritis in his right knee. Charlie also has a couple of other issues. He has a syndrome, a tremor syndrome, and this may have helped him as well. But you can see that he's really very interested more about Mom and what Mom's offering him, and a whole lot less interested about having these sharp needles in him.
Yeah,
And they're really
what a
not
good
so
dog.
painful. And there's different ways that we can stimulate these needles too. One way we can just use our fingers to do this
Twist them a bit.
and twist them a bit. And there's different ways. If you have different issues, you may want to twist in, twist out, push in, pull out, depending upon the treatment that you're trying to do. When Charlie is treated, normally he'll have up to 15 needles in him.
Yeah, that was my next
So-
question. How many needles would they have?
Well, we can
Depending
talk
on-
about the number of needles. It depends upon the particular ailment that we're treating. If it's a resuscitation type of thing, it may only take one needle. And one area that everybody should probably know on their pet, and let's see if we can, Charlie, you want to move your head?
Smile
I'm
for the
sorry.
camera, Charlie.
Is right here. If we were to
Oh, on
press
their
here,
nose?
where my index finger is, and put a fair amount of pressure to a dog that has had gone into, let's say, a coma and needs to be resuscitated,
Kind of shock. Yeah.
that's one area that we can do that.
That's good to know.
For dogs that have epileptic seizures, one thing that a client can do, the pet owner can do, is he has a little pad right here. If we were to try to do deep massage underneath that pad, that would reduce the seizure time. So that's an important one
Wow.
for people to recognize or know.
I
Underneath
can't see
the
that
foot.
very well, but
But underneath the foot.
there you go.
Here, maybe I can
that
try to
again.
demonstrate this one more time.
Yeah.
Charlie, you're being wonderful. So just under here, where my thumb is. Just
Yeah.
under that. So deep massage there. Okay, good boy. All right, I guess we'll let Charlie go. I'm going to take his needles out, and then we can have more of our conversation. Thank you. Thank you so much, Pam.
Oh, you're most welcome.
Thank you, Charlie.
Thank you, Pam.
Charlie, you did
Charlie.
wonderful,
You
Charlie.
You're an angel, kiddo.
What a
You
good
can come
boy.
back anytime.
Yeah.
Okay.
Thank you so much. Okay.
Wow, he really did
He's
handle that
good,
well.
yeah.
What a trooper.
He's a good guy. Charlie's had 6 acupuncture treatments, I believe.
Really?
Yeah, so he might be on his 6th or 7th.
Now, does it work best in series, or are there some conditions where it's just a one-time session, or is it typical to have?
Well, I'll give
Follow-ups
you an
closely.
example that where I used it as a one-time thing this week. I was doing oral surgery on a dog, and I had to remove a tooth. And the dog was under general anesthetic, but was fussing a little bit because of the discomfort from the tooth. And so what I had done is I had placed the needles in this dog using acupuncture needles, and I didn't need to adjust the anesthesia.
Wow.
So that gave it enough analgesia so that we were able to just finish up the procedure. And it was, in my opinion, safer for the dog at that. So that would be a
Fabulous.
one-time use. Resuscitation, where I was talking about for a dog that had passed out, would be the point right here that I was trying to show on Charlie. That
That's
would likely be a
wonderful. It's the same
one-time
for
type of
humans.
thing. It is the same on
Is it?
people.
Is it the
Go
same
on
for people?
Poking people in the
You start
nose.
poking people in the nose.
Start
yeah.
fainting. I'll just.
As part of their CPR. What is that person poking that person in the nose for? That kind of thing.
Yeah.
But we might also do what I was showing on the paw. That would be like a one-time type of thing.
Okay.
If I have a patient that comes in and they have an acute case of vomiting or diarrhea, I'll likely do just one session of acupuncture.
Right. So it depends on how chronic if it's just a short-term or chronic situation.
Now with Charlie's situation is chronic because he has arthritis. So what we do is we'll see Charlie now that he's gone through a period of treatments. What we'll do is we'll wind up treating him like once every 5 to 6 weeks. That's Charlie's schedule.
So then you taper it out.
We taper it out routinely. If someone was going to come to my office and they were going to ask us about acupuncture, and we were going to start a session on a chronic case, a case of pain, let's say, for arthritis, we'd ask them to commit to 6 consecutive weeks.
Okay.
And then what we do is we start tapering out and doing the least number of treatments that we'd have to do. As the pet gets older, it's harder to go much further than 5 or 6 weeks. The young pets, sometimes I see quarterly. I don't need to see so often. So,
why is that different between the younger and the older?
I think it's the energy
Healing
level
process is
that
quicker.
the young have opposed to the old. It's their resources. They have far better resources.
And you said initially that was one of your reasons for pursuing this type of modality because of the older patients, like you wanted to find...
Most definitely, because a lot of the medications that we have and we use, including myself, can cause ill effects. We can have kidney or liver failure.
Yes.
So if I have a patient that's in liver failure and I want to help it, I can't necessarily say take this drug. So I have to have something else, and that something else I have has been acupuncture.
That's wonderful. That's really wonderful that you did that, you know? I mean, you're helping the animals so much by doing that. And I'm a big animal rights person. And that's wonderful. Anything anyone does for the animals is just like, they got my heart, you know? So, because they're mute.
That they are.
And we have to speak up for them, and we have to help them as much as we can. So we do it by sensing. It's like you said, you have to be sensitive and you have to be aware. So forth, so.
And they pick up on that.
Oh, they do?
They do, most definitely.
They really, really do.
And what conditions do you see most in our domestic pets? I mean, do you think that there's conditions related to the lifestyles that they have with us, or as opposed to nature?
We drive them crazy.
So what lifestyle that the pet might have that is going to necessitate my
treatment,
visits? Right. It's the good lifestyle. It's the love that they've had. It's the fact that they're living longer than they did when I first started to practice. If a pet was 8, 9, 10 years old, that might have been its life. But now it's not unusual. I think I have a 19-year-old Chihuahua in the practice. So it's not unusual for us to have these older pets, and just like us, where their joints start wearing out, they need some more help. And this is one of the means to help them. So.
Do you see any conditions related to diet or...
like we're saying, like what kind of makes them ill in the first place? Do you think that just conditions that are inherited?
Well, ill in the first place, I guess I was thinking more about pain treatment. As far as the other things were liver failure, kidney failure, etc. I think that a lot of that, in my practice, I don't normally see too many young patients like that.
Right.
So I'm very fortunate. And most of it's the geriatric patient that is. So I can't really say that there's too much that's going on other than the food that we eat and the water that we drink. Nitrites and nitrates are toxic, and it's hard to escape that. And some of the lesser quality pet foods.
Oh yeah, there's a lot of those.
Will add to it. So
supermarket pet food is all meat byproducts and not good at all. And meat, unless it's organic, is filled with hormones, steroids, antibiotics, pesticides.
It's hard to escape that.
People get it, and we get, and animals get it. You know, and
well, the sad truth is that most of the things that go into pet food
are the lower qualities.
Can be the lower quality,
Yeah.
what they call the 3D, or dead, dying, and diseased.
Right.
The things that can't cross our plates.
That's right.
So.
And also,
Very sad.
eating too much meat and protein is hard on the kidneys anyway. We know that for people, and it's the same thing for animals.
Yeah.
And all animals eat a lot of protein. I mean, I know I've known a
They're
vegetarian
carnivores,
cat.
though, by nature,
Yeah.
too.
Well,
though,
no,
so.
but they can be trained, but it's hard. It's hard for a person owning them, I know, but I knew people who had. Can you imagine a vegan cat? And she was plump and just as happy as could be. And I've known other people that had their, vegetarian dogs. And
yeah,
it works.
That's very, very difficult.
It is.
It can happen, but
Yeah.
it's very difficult.
Would have
Cats
to-
especially are hard to balance their diets.
So,
That's-
vegan
And
cat.
very finicky.
Right.
Yeah. She
And
was
one of the
happy.
things that I know by using, trying to use herbs on pets is we need to be careful because they don't necessarily digest them so well.
Okay.
And it doesn't make a pet or a pet's human very happy to give them something that then makes them have soft stool. They don't want that. Start with one problem and create yet a different thing. So we do have to be careful about that too. So even with herbs, it is a bit of a challenge, and I have to wean them too.
Do you incorporate the Chinese herbs with the acupuncture
I do.
treatments? You do.
Because acupuncture is considered a surgical technique, actually. That's how the state board sees it. The other things that we do with the herbs are to try to extend my acupuncture treatments out so that I have more of a lasting effect. So they're there to help to supplement. Sometimes we'll use herbs by themselves, but many times it's just as an adjunct to the acupuncture.
And people really shouldn't give their animals any herbs unless
Yeah, unless they're advised
take them to a doctor
Mm-hmm.
and so forth, right? I mean,
Exactly, because they can be toxic, and
Yes.
as we know, not everything that one reads on the internet is true.
that's right.
Yes, we stress that on the show, just, that even if you're, looking up supplements and you think you have, something that's recommended by hundreds of people, it may not be what the right chemistry for your particular body type or your pet's body type.
Exactly, and if they should do that by chance, they should most definitely inform their veterinarian what
Right.
they're giving.
Right.
Yeah,
Because
especially
that
if
helps the
they're on
veterinarian.
another medication, you never know what.
Right, you don't know what combinations that they may have that may cause an ill effect.
Mm.
Most definitely.
How long does it take to to learn the acupuncture? How long did you study?
There are, in the United States, 3 different schools right now. When I studied, there was only one school. It was the International Veterinary Acupuncture Society that was offering courses. And that group was founded in 1974. They're the group that taught me. All 3 schools, mine, the International Veterinary Acupuncture Society, or IVAS, the Chi Institute, which is in Florida, and Colorado State University. They all offer programs, and they're all around the same time frame. And that time frame is around a year of study.
Mm-hmm.
What you need to be is a veterinarian to begin with. They'll only
Right, so
accept
there's
veterinarians.
all of that training beforehand.
So you have to be a
Mhm.
licensed veterinarian. And then it's approximately a year's study, 40 hours or so of interning with a certified veterinary acupuncturist.
Mhm.
And then you have to write 2 publishable case studies. And then they'll award a certificate. And in the state of Connecticut, in order to perform acupuncture on pets legally, you have to be a veterinarian. So in other states, you might be able to be a human acupuncturist and, under the guidance of a veterinarian, perform it on pets.
Are there many acupuncturists in Connecticut that do this on animals?
When I started, some 15 years ago, there were 7 of us. Now, I believe there's around 15
In Connecticut?
in Connecticut.
Still not a lot.
No,
No,
it's not.
when you
So-
think that there's over almost 700 veterinarians in the state of Connecticut, small state, lots of vets.
Yeah, lots of people who love their pets too. How long does the actual session with the patient, with the animal, last? I mean, is it quick, or do they have to remain
Well, what
rested
we
for
did
a
with
while?
Charlie was pretty much
That was
for
quick, yeah.
demonstration purposes. If a patient comes in, and I did several of these today, they're normally at our office for about a half hour. The actual time that the needles are in the pet is about anywhere between 10 and 15 minutes. And there's different ways to stimulate these needles. We use a lot of electrical stimulation because it has a better effect in pain relief. So we'll actually hook up these little electrodes to some of the acupuncture points and use very low current, and the pets seem to like that because it's almost like an internal massage. So it's like using a TENS, except it's very deep. It's on the acupuncture needles. So normally 10 to 15 minutes is how long that they're in.
How do you locate the particular points that you need to place the needle?
That's where
Practice.
the magic comes in.
That's the magic. Right?
That's the magic. The way we
woo.
locate the points is a very good. I had to learn my anatomy really well. You use basic anatomy, and what you do is you, from certain locations that you know, what you would do is, in a human being, this is considered, one's thumb is considered a body inch. In pets, I use the breadth of the last rib. So on a small dog, it might be just my pinky or my index finger I might use.
So you measure.
And I'm measuring parts from one part of the body to another, and using that, I can find the acupuncture points.
Wow.
There's other ways to find acupuncture points, because an acupuncture point is an area of low electrical resistance. So they have these little gizmos that are actually point finders.
Wow.
So you can go over, whether you're a human or a pet, you can go over the skin and literally find where that acupuncture point is.
And that's effective. Those tools are effective. In finding
They're
those?
quite effective. They're quite good.
That's amazing, because that would probably help the patient, or the patient, I should say, their owner, realize that there's some, truth to this. If they can
we
see
have
that
that.
there's, the point. Oh, look, it's.
I usually
radar.
demonstrate that on the owner to show them, hey, this is where you can
Right.
find something. On the pets most times, though, because we're putting in, again, anywhere from 1 to up to 20 needles. So I don't use a little point finder and just practice, practice. You find them in,
Repetition,
there's
too.
charts that we learn and study. Now there's acupuncture points fall on something called a channel or a meridian.
Right.
And there are 12 associated with the Chinese organs or Zhang Fu organs. And what we'll do is we'll use up to 150 acupuncture points might be in my repertoire. However, normally there might be 365 that lie on those channels. And if we were to include all acupuncture points, auricular points, ear points too, there could be as many as 2,000 points. So it's a little hard to remember so many. So what I've done is I've felt very comfortable with my 150 or so. And you can use those in combinations, like a phone number. If you've got 7 digits in a phone number, you can imagine how many combinations you can use in the 150.
Right.
In the United States, we learn them as numbers, the organ and the number, like large intestine 4 or stomach 36. In China, they learn them by name. So they've learned all these by name.
Liver point,
Wow.
such and such, or yes.
Right. So it's hard to make the translation from Chinese into English,
Western, yeah.
and a lot of it is seems poetic to us, and it doesn't make a whole lot of sense to Western practitioners. So they try to make it as simple as possible.
Right, right. How much of your practice would you say is devoted to acupuncture?
Well, that kind of question. I would say the patients that come to me solely for acupuncture would be about 25%. However, 100% actually
Right,
experience some
experience
sort
it.
of
That's
acupuncture in my
great.
practice.
Oh, that's good.
Because there are different forms of acupuncture.
Right. Even if it's just to relax your pet, right? Or
Well, whether it's to
to-
relax your pet or
You said it's different forms. What are the forms? Ah.
If I was to give, and for instance, I did this several times today, if I was to give medication by way of an injection, what I will do is I will use that injection in acupuncture points. So I'm doing what's called aquapuncture. I'm doing a form of acupuncture by injecting my medication in an acupuncture point. And so I'm not only getting the benefit of that medication, but I'm also getting the benefit that I'm stimulating, irritating an acupuncture point associated with the problem that I feel I need to treat.
Wow, that's wonderful.
And in addition to that, I can't do just a Western exam any longer. I do my Western exam, but it's incorporated with an Eastern exam. So I'm doing a traditional Chinese medicine exam.
Like the
so this is where I
and
say
the tongue
100.
and the
So I'm checking tongue, I'm checking pulse,
eyes,
odor, eyes, the color, the hair. So you're looking at more than just getting a heart rate or respiration rate or temperature. And when I do that, the other thing about acupuncture is that there are diagnostic points. So and I could have shown on Charlie, but as I'm going over the spine, there's certain areas that if there's a tenderness in that, that might be associated with a heart condition. Or in a certain area, it might be associated with a liver condition, or it might be associated with a kidney condition. And studies have been done that correlate the tenderness in those points to actually elevations in blood values. So it's almost as a test to see, well, I think that there's a liver problem here because this is how this palpates or feels to me.
Yeah.
It's tender. And then we'll do the lab test and see if we're on the money. And more than 50% of the time, we're definitely on the money. So there's a lot to it. So I say 25%, but
the whole
it's really
diagnostic aspect too adds.
it's all incorporated. So
Wow.
it's given me more for my patients in my mind.
Wow.
So
They don't have to be tranquilized or anything like that to
that's
get this, do
that's
they?
the great thing. I don't necessarily believe that they should. And the pet that seems too irritated to have this dry needle technique done, where we're actually placing the needles in, if they seem like they're too anxious, then what we'll do is we'll go back to the aquapuncture. And I'll use, one can use vitamin B, you can use vitamin C, sterile water, anything as a liquid to inject. I prefer to use vitamin B12, and I get the benefit of the vitamin B12 in addition to stimulating the acupuncture points. So if a pet doesn't seem to be able to stay still long enough for that 10-15 minute period, what we'll do is we'll do that. So it's a quick way to do it. And there's medicines that I'll even send home with people and teach them if they need to do injections at home. I'll teach them, I'll clip the hair away from certain acupuncture points, and if we need to, we'll put a little Sharpie mark on.
You can work on this point too,
and you can work on that point. So there's certain things that they can do as well.
And even just stimulating the points, like through acupressure, is a good technique.
Exactly.
I think you were doing that on Charlie a little bit, weren't you? Acupressure. I thought you were a little.
I think I was.
Moving
what you might have seen me do was locate my points.
Oh, okay.
So I was going over his spine, and then I was using his rib and finding where I needed to go.
Okay.
So I wasn't using my finger on that thing. I was using landmarks, and I knew where to be.
Right.
So, but I definitely, for the in-between treatment periods, I definitely will show clients what to do as far as acupressure. There's also something called moxa. And moxa is, mugwort is an herb that looks like a cigar, and it burns. And you can stimulate by heat on acupuncture points. So it's moxibustion. It's another form of acupuncture, even though we're not piercing the skin with a needle.
They do to pregnant ladies so they can have their babies faster. Under the feet. It's a wise, I don't know if it's truth or wise tale, but...
Well, I'd be very cautious about that, making sure you want to have the baby at that time.
Well, if the baby's late, that's one of the
well, that's one of the things we might have touched on. Who might you not want to do acupuncture on? And that would be, for me, a pregnant patient, because I might induce labor
Right.
by doing
when
that.
we had an acupuncturist on here, he was talking about people with cancer, and that a lot of times that's a tricky area too, because when you open up those meridians, they're also travel highways, so the cancer cells can take those highways and spread. So you have to get the cancer to a certain control point before
He is so right.
Okay.
He is so right in that. And there are a couple of schools of thought on treating cancer patients, but I completely agree with that. What you can do is make the cancer worse, and the best thing to do is to have the cancer under control. A lot of acupuncturists, human and veterinarian,
because I'm sure
wind up. I'm sorry?
Because you would think like, oh, this could be a way to treat this problem, which is running rampant, pets and humans alike.
Do you have a way to treat the cancer?
Well, we will use some herbals to do that more than acupuncture.
With an acupuncture.
But I don't necessarily feel that some of the things that we do are necessarily as effective. But if it's not within a person's means to do chemo or have surgery, when it comes to trying to alleviate some of that discomfort, we definitely have some alternatives. The primary thing that we use acupuncture for in the cancer patient, once it's had some control, is to deal with the side effects of the chemotherapy.
Oh, okay.
There's a lot of nausea associated, diarrhea issues, and we will help the pet along through that. So we're working together, and a lot of veterinary oncologists actually do use acupuncture to help this. So we will do that.
So what conditions does acupuncture work best on in animals?
I think that what my highest level of experience in is to alleviate discomfort. Now that discomfort could be associated with arthritis, no matter what joint we're dealing with, or discomfort associated with disc disease, which we see a lot of. A lot of dogs that have painful backs, painful necks, and painful hips. But how we also treat asthma, inflammatory bowel disease. We'll treat these conditions. Some skin conditions, it's not as effective in my hands in treating the average, let's say, allergy type of a case.
I was going to ask you about allergies. I've run into a lot of dogs that have allergy problems.
Yeah. It can help things like hot spots.
Yeah.
Can relieve that. But a lot of the herbs are probably a little bit more effective in helping that. And again, nutrition. But I'm just trying to think of what other things. It has been used for immune disorders. It can be used for incontinence, urine incontinence or stool incontinence.
What about like a cat that sprays or something like that with I don't know if it's necessarily behavioral or physiological.
If it's you've got a good point that I want to touch on too, and I guess I'll get to that in a second. If the cat has a disruption in its spirit, its shen, then it likely could help, and you can do other things. Acupuncture by itself is a modality that isn't this panacea that's going to help everything, but used with other things is definitely beneficial, especially for like that cat. But what I was going to touch on was getting a good diagnosis. And that is just so important. And the cases that are referred to me, a diagnosis is not only like a Chinese type of diagnosis, but a Western diagnosis. So in your cat case, if the cat's upset because the furniture was moved, that's one thing. But if the cat has a urinary tract issue because it's got crystals, or as an older cat with an infection, that's another thing. So you really have to have a good feeling for what's causing the problem so that you can focus on the proper treatment. Case in point, I had a dog sent to me that they thought that had elbow arthritis. And I examined the dog to find out it actually had cancer of the bone. And I wasn't going to be able to help that dog through acupuncture to long-term assisted. It was just going to be palliative. So the Western diagnosis is very important too.
It's interesting. It's good to have both of those at hand, for diagnosis.
Well, I think that that's just so important, and all groups need to work together. You know, as they say, it's
We're all
better to
part of
have
it,
an
part of a
open
team.
mind.
Yep.
You know, open mind is like an open parachute. They work a whole lot better. Right?
Yes.
Do all pets respond to the acupuncture?
I would say that 75% of the patients that I treat respond. Now, it's what one's expectations might be.
Right.
Is the 14-year-old dog going to play Frisbee again? Likely not, but will it get its toy and bring it to you? And that's one of the main things that people might say to us after the third or fourth week. So-and-so, you know, Shaman just brought this toy it hasn't touched in 3 months. And that's where we start to know that things are going better. And I say 75%. My staff might think it's better than that, but I'd say 75%. And I'm always likely the biggest skeptic and the happiest person in the room when we're doing this, when people tell me these things, because I'm thinking, wow, it worked again. I'm just so happy about that.
Do you ever see some, like, I know in some work, even in massage, for instance, there's like a detox effect, or sometimes it feels like there's like a boomerang issue with health initially, but it's a clearing. Do you ever see any of that?
Excellent question. Yes.
Okay.
What'll happen many times is when we do a treatment, the pet might go home and just be
Lay
so
around.
tired.
Yeah.
The first 48 hours, it may not do much. In fact, there might be, if it's a soreness issue, it might actually be more sore for a day or two. And then there is that rebound. Then they're back to where they were, or they're back to where they were maybe 3 months ago or a year ago. So we definitely see that.
Yeah, I think
very
that's
common.
important for owners to know, because they might call you up saying, you made this situation worse. Yes.
And we discuss that with them, and we give them handouts, and they see that. It's also very important that they not feed the pet a whole lot before or afterwards, and that they're hydrated. So that what we want, the energy is to focus on what we're doing and not digesting food or going on a hike.
Right, exactly.
You know, I just had my acupuncture treatment, now it's time to go for a 3-mile hike. No, I don't think so. It's time to go home and rest.
We do the same thing when we do Reiki on the people. You know, I suggest they don't eat much when they come, and don't drink coffee or anything stimulating. And after they go home, you know, just rest, and, you know. So it's the same thing with the animals. Yeah.
I think anytime you're working with any type of biological or energy systems within the body, I mean, you're stirring things up and you get reactions, but it's a good stirring because it allows release to occur.
Exactly. And that's the one thing about the number, we're talking about the number of needles too. If I was overzealous and decided to use,
Your pincushion.
you know, I know 150, I know 400 points, I'm going to put all these in because more must be better. And more isn't necessarily better
it's not.
because it dilutes,
Shocking, yeah,
it
too.
actually dilutes the treatment rather than stimulates it. So,
That's an interesting point.
Are there any pets that should not receive acupuncture?
well, we touched on one, and that would be the pregnant pet,
Right.
unless you want to induce labor
Right.
and assist labor, or after the fact assist lactation, which you can do too. So those, I think that the truly debilitated pet would likely not be able to handle acupuncture. There could be that rebound where the pet did
It's too much
very
for them.
well, and then we lost it. And that can happen because all the energy is just utilized, and they just can't handle it. So for the truly debilitated, I'll be very, very careful about how I approach it with acupuncture. So, patients that I feel wouldn't necessarily do well might be, we were talking a little bit about the dog that has, or cat that has disc disease. If they're paralyzed and they have no sensation of pain in their back legs, those I give a poor prognosis, and I'll usually tell people that I don't feel that I can help them. If they're just a little bit wobbly, if they have still have reflexes, then I can definitely do something to help them.
Okay, and how about like neurological problems or?
Neurological
anxiety.
problems.
There's a lot of pets with anxiety. What
That
seems to be.
because not too many people are wanting to come back a lot for that. What I'll do is I'll try to show people what they can do to try to alleviate that. Or we touched a little bit on Charlie and the Bach flower remedies.
Yes.
Might select something of that nature.
Yeah, those are
You
Do you
do.
find that that's effective for calming the?
I think that rescue remedy does help, and then rescue remedy is great because you can
It's
put it
great
in their
for people,
drinking
too.
water. You can just
Easily
put
disguised.
it.
You
Put
can
it a
rub
little
it
bit.
on their skin, even, right?
Yeah.
And it's absorbing.
Yeah, it's nice. There's a couple of products out too that are maternal hormones, and by having that in the pet's environment, that's very calming to them as well. They have it for both cats and for dogs. So things like that. And we use, for anxiety, we'll use some calming herbs, that kind of thing. A little bit more. When they're treating anxiety for a pet, it's more for the anxiety that they have while they're with me.
Yeah.
And that's normally only the first couple of trips.
Yeah.
Then they seem to like it. There's a lot of bonding between the client and the pet during the whole sessions because they're with the pet.
Right.
They're
And they need to
holding them and they're
establish that
comforting,
trust, yeah.
and it's very nice. I think that they just enjoy that time together.
Well, I have a question, and we had to come to it. How about when it's time for the pet to pass over and they bring them to you, to put down? Is there anything acupuncture can help with that?
I guess that I've not pursued that,
Oh, okay.
but I think that it is something that maybe I would try. If nothing else, is to try again to work on some of the again spirit Shen type of calming points, and work on that. A lot of the heart points. That's a good
Yeah,
thing to give
I would say,
give a try
something
to.
to calm them down or something like that,
Yeah. I mean, most of them, by the time that they're ready, they're, in my practice anyway, they're pretty calm.
Yeah.
We do help them along in many different ways so that they are prepared.
How can an owner help to prepare, like, the pet before an acupuncture treatment? I know you touched upon, don't eat too much and stay hydrated, but is there anything else they should know or do beforehand?
You know why I'm smiling?
What?
Because it's not so much about the pet. It's about the
The
owner. If
They
I
need
can,
to stay calm themselves, right?
if I can take care of the owner's anxiety level, then I've taken care of the pets.
And how
And
do
so
you
many
do that?
times I talk to the owner.
Yeah.
I explain to them in depth what's going on. Sometimes they don't even see the first needle that goes in because it just goes in. Then we'll manipulate the needle a little bit. They see that it wasn't painful. They take a big sigh. And then we go on.
Is it typical for the owner to stay in the room or to leave?
Almost always,
Okay.
99% of the time. Occasionally, if the pet seems more agitated because the owner's there, I'll place the needles and then ask the owner to come in. And then we'll go from there.
Okay.
But most times, I'm one of these people that would prefer that the owner sees everything that I do
Okay.
to take the mystery away from it, so that they understand and it makes them feel better. And I think that helps the pet.
What kind of animals have you worked on? You mentioned something to us before about a bird and so
Oh.
forth. What kind of animals have you worked
Okay.
on?
Dogs and cats.
That's all?
I'm pretty limited. I've been trained to treat everything.
Goldfish.
Well,
I think I heard a joke about that one time, acupuncture on the goldfish.
oh, but you laugh.
I know, when you love your pets, I do.
There
I do know.
there are people, at least out of experimentation, that I'm sure have. Iguanas, every walk of life. Snake, turtles, whatever that might make its way into the office. But it comes down to what I had mentioned before, having a good feeling for the Western medicine in order to help with what I do. And because I'm trained mostly in dogs and cats over what I've chosen to study through all these years. When we go to veterinary college, we're trained in everything. But growing up, again, my bio in New York City, it was hard to get too many horses,
Experience,
cows, and that kind of experience.
I have a friend who's a veterinary doctor, and where she grew up, I mean, it was mostly horse. She was, on farms treating horses. So,
right. So I limit it to do the very best job I can on dogs and cats.
That's good. If you have a niche and you do it well, we need people.
Would you like to do other animals in the future?
Oh, perhaps in my retirement.
I know. I'm like, what are you going to learn next? You took on the acupuncture.
I think that my whole thing is I want to do something and do it well.
Right.
And to be honest, this is an art that might take me another 15 years to perfect.
Okay.
Yeah,
Yes.
it's
I
so
understand.
After 15
complex,
years,
it
I'm
is
still
complex.
learning
Yes.
every day
I understand.
and surprised every day.
Yeah.
And the beautiful thing about being a veterinarian is that you don't know from 20 minutes what you're going to see next. It might be this or this, a big, small, kitten, 18-year-old. You never know. And there's enough variety in what I do, and I really want to do it well. So I think I'll limit it to dogs and cats.
Well,
Is there any, do you know of any veterinarians that do on farm animals or horses or things like that?
There are some veterinarians in the state that definitely do perform acupuncture on horses. I think that most equine practitioners or horse doctors will perform some form of acupuncture. It's very well accepted in the equine field. And we're touching on different ways to stimulate acupuncture points. I also use a low level laser, and that the laser light can actually stimulate on these points, and they use a lot of that in equine medicine.
Well, we have to say goodbye. I know there's so much more we can talk about, so many other avenues, but we're really grateful that there's people like you out there doing this work.
Definitely.
Well, thank you very much,
So
and thank you
glad
so much
we
again for this
found you.
opportunity.
Thank you for being
It's
on
been
our
great.
show.
Thank you so much. Very, very much.
And so we're going to put
Well,
up
we're
our
going to
information.
give some information first.